GMH Acting Administrator Ray Vega says a recent audit outlining the financial highlights of Guam's only civilian hospital are due to seeing more self-pay patients that have doubled over the years, which is a direct reflection on the economy.
Those are numbers, and we see the numbers as the way they're present. But the factors that's affecting this one is that, as I mentioned earlier, the self-pay twice as much doubled. And because of the economy, the self-pay is actually a no-pay.
The report noted 46% of GMH's patient revenues came from Medicare, Medicaid, and MIP, which Vega says has significant contractual adjustments of $38.9 million, or 57%. Auditors also report that GMH stopped remitting not only the employer's share, but also employees' share of retirement contributions to the retirement fund. Cumulative unpaid retirement contributions, including interest and penalties, now stand at $15.1 million, which is a 69% increase from fiscal year 2010. Vega says he will look into the additional findings, but does acknowledge changes are necessary, including implementing more cost containment measures, changing its systems, such as outsourcing its billing and collection.
Well, the challenge is, as I mentioned earlier, is the self-pay. We will continue to service the population. We will not compromise the care. That's been the mission of Guam Memorial Hospital.
Additionally, the report stated that employee income tax withholdings of $6.4 million were unpaid as of September 30, 2011, which incurred interest and penalties of $585,000 due to non-payment of withholding taxes. Committee on Health Chair Senator Dennis Rodriguez Jr., meanwhile, is concerned considering the change of management early last year promised improvement.
When this new management came in, when the old management was replaced, the people of Guam were promised that major changes would happen there. We'll see a turnaround in finances because we know the hospital has been challenged financially. Obviously, you see now that that's not the case.
Rodriguez notes that the change up occurred in February, or about halfway through the fiscal year, but it still left a lot of time to do some sort of turnaround. And although he hadn't fully read the report, Governor Eddie Calvo recognizes the GMH board and management have a lot to fix.
We also understand that the amount of subsidies that have gone to that hospital as compared to previous years has gone down dramatically. When I was chairman of Ways and Means, we put 6.9% of gross receipts tax collections into the hospital for subsidization, as well as we floated certain bonds that gave them monies for capital improvement projects. So over the past few years, again, the legislature in all its wisdom has reduced the subsidies to this hospital.